Welcome to the BioNexus Health podcast with Dr. Jodie Dashore, who holds a Ph.D. in Integrative Medicine, is board certified in Integrative Pediatrics, an internationally recognized pioneering clinician, and author. And now here's your host of BioNexus Health podcast, Dr. Jodie Dashore.
Hello, everyone. Let's talk a little bit about PANDAS today. Many children diagnosed with autism also have a concurrent diagnosis of PANDAS, and I am going to discuss the extremely important aspects of PANDAS and speech. So, pediatric acute onset neuropsychiatric syndrome, PANDAS, is known to be caused by a combination of inflammatory mechanisms, including autoimmunity, neuroinflammation, and metabolic disturbances as well. Let's take a closer look at the mechanisms. Autoimmunity. So antibodies from your immune system that are normally created to fight foreign germs can mistakenly attack the body's own proteins, especially in the basal ganglia of the brain. A neurological inflammation. Inflammation in the brain can be caused by immune responses to pathogens or germs. Metabolic disturbances also play an important role. Changes in blood sugar levels and other metabolic markers have been found in many PANDAS patients. Some of the triggers are infections like strep throat, scarlet fever, perianal streptococcus, mycoplasma pneumonia, staphylococcus, MARCoNS, or multiple antibiotic-resistant coagulase-negative staph, Lyme disease or Borrelia burgdorferi, mold exposure and mycotoxins. All of these can trigger PANDAS. Stress is another big factor. Stressful life events can contribute to worsening of PANDAS or can cause a PANDAS flare. Now, let's talk about some of the symptoms of PANDAS that can be mistaken as autism. Obsessive compulsive disorder, eating restrictions or picky eating, motor tics can often look like stims, cognitive and behavioral deterioration, anxiety, including separation anxiety from one parent, depression often plays a role, irritability, anger, aggression for no obvious reason, difficulty with schoolwork, focus, learning disability, fine motor, pencil skills can be affected. Oftentimes, gross motor skills can often be affected as well. Now, let's talk a little bit about the basal ganglia in the brain and the important role in speech acquisition, learning, behavior, and multiple aspects of speech development. So the basal ganglia are a group of brain structures located near the center of the brain. They are involved in learning, emotional processing, speech, decision-making, motivation, and forming habits. Now, the basal ganglia play a very important role in speech production, speech perception, including sequence processing, vocal emotion, and temporal processing. Now, with speech production, the basal ganglia are involved in sequence processing, movement vigor, speech initiation as well. Any problems in these areas can lead to syntax deficits, not being able to pronounce the word correctly, not speaking with the correct pressure or force, leading to hypophonia or hypokinetic dysarthria type of diagnosis. Another role of the basal ganglia is speech perception, which involves vocal emotion. So basal ganglia can help decode emotional information from vocal cues and the rhythmic aspects of speech. For example, the changes in your voice when you get angry or sad. The next aspect of speech perception that the basal ganglia are involved with is known as temporal processing. The basal ganglia can help process temporal patterns in acoustic stimuli. It's a key aspect of how we perceive and differentiate sounds, like the rhythm or pulse within a musical piece or the distinct pattern of speech sounds, like recognizing that it is your mom speaking or it is your brother's voice would be one example. Next, in speech perception would be auditory monitoring. Now, monitoring the rhythm and the rhythmic aspects of speech, just similar to the rhythmic beats in music, is another function of the basal ganglia. Then comes the aspect of speech learning. Now, with speech learning, category decision making, right? Now, what is that? That is a cognitive process where a listener identifies and classifies a spoken sound or word by mentally grouping it into a specific category based on its acoustic features, like, what it sounds like. One example would be animal, fruit, verb. If a particular sound belongs to which category, and it involves making a mental decision about which category a sound falls into based on its characteristics. It's a very high function of speech acquisition. And then comes phonetic representations. This is the other aspect that falls under speech learning. Now, phonetic representation is the function that is responsible for describing speech as it's actually happening, meaning as a physical phenomenon. That is, it covers measurable aspects of articulation, listening acoustics, and audition. The classic example would be the letter P, the way it sounds, P for Peter, versus B for boy. Now, different speakers will produce the actual physical sound corresponding to B for boy in different ways. So there are many similar but non-identical sounds that adults recognize as B. Again, it is one of the higher functions of speech. So all of this tells us that basal ganglia is a very important coordinator of speech and language. And we know that speech and language acquisition, production, maintenance, development, additional higher learning, progressing to pragmatic language is a function of bilateral hemispheres in the brain. And basal ganglia play a critical role in acquisition. Many children with autism have the diagnosis of PANDAS, and it is important that as a parent or a caregiver of a child with autism, comorbid with PANDAS, to understand that it is going to take significant amount of time for speech and language to develop. Of course, that is directly corresponding with the damage or the brain inflammation that has occurred in that particular child, right? Some of these aspects will need additional explanation. If you have any questions, as always, feel free to message me, and I will definitely, elaborate a little bit more on these aspects of speech acquisition, right? So these are, some of the important secrets that you need to understand, you need to discuss with your speech therapist. Now, let's welcome Alexandra to today's podcast. Alexandra, many of you must have seen her wonderful videos that she has been very kind enough to share with us. Now, Alexandra is helping many families with autism spectrum disorders, along with PANDAS comorbidities. And we have observed a few specific aspects of speech delay, which when addressed, like many parents forget to address those, but when those are addressed, we see a dramatic improvement in speech and language, both verbal and nonverbal. Usually, we might see nonverbal coming in first, but let's go ahead and have a nice, robust discussion with Alexandra. And I'm going to welcome Alexandra to the podcast now. Hey, Alexandra. So welcome back for the for the 20th time to today's podcast.
Hi, Dr. Dashore. Thank you.
Hi, hello. Of course, yeah, it's always a pleasure. For those watching, you've seen what I have talked about prior to welcoming Alexandra to the podcast. So this is going to be the autism parent, the PANDAS parent perspective of things when it comes to some of the important factors to look for, things that matter when you're working on speech and language development in your child. It doesn't just automatically happen, and it won't happen if you simply send your child to therapy, etc. Of course, you will see some improvements, but to get the biggest bang with speech and language development in your child, there are certain common sense aspects which many of us as parents may miss. So that is what I have invited Alexandra here to discuss with us from a parent perspective. Right, Alexandra?
Yes. So basically, where I always like to start reminding friends of mine, parents that are in this situation, I'm always going back to the somehow diagnosis. We go always back to what PANS and PANDAS means. And if you take the name, just the name, you're going to see in the name that PANDAS means pediatric autoimmune, and I will underline it with red and with speech marks, autoimmune neuropsychiatric disorder associated with streptococcal, or we know that for PANS is broad spectrum, infections. Yes, so when we are talking about autoimmune and infections, we know somehow to look for the triggers that might set our kids into a flare. We can always see them hyper, we can always see them not responding to the treatments as we would expect it, and we don't necessarily know to identify the signs. This is what I'm seeing in my friends, this is what I'm seeing generally in people, that they are saying, oh, I've started that product, I can't see anything, it doesn't do anything for us, but they don't work at all in lowering what can trigger the autoimmune aspect of it or the infection side of the story. And this is what I always like to go back to the beginning, and let's discuss today about what tools every parent should have in their hands to identify things and to give some actions. So I'm always having my notebook with me. Every night before I go to bed, I just write down whatever happening that day. And bear in mind, we are now in the moment where we are traveling a lot. My kids are in literally, I don't like to use the word recovered, but we are on the maintenance protocol already. We are maintaining the results that we have achieved.
So wait.
The last 2 years.
Yes, I'm glad you're mentioning the 2 years, because you said, already on the maintenance, it's been a lot of hard work on, on your part, like understanding the aspect of the disease, the additional conditions that your children have in order for them to get better, like, creating. So I will try and link to Alexandra's previous podcast. Alexandra has spoken in great detail recently about how she has achieved wonderful results with her children, right? Now, if you could talk a little bit about things that can be missed, it is, right, versus just expecting a speech and language to come in, like things like some children can have a tongue tie, some can get, repeated ear infections. And I'll chime in. I mean, let's have a nice, robust discussion and go ahead. I mean, feel free to interrupt me. This should be.
I'm just thinking like how it's going to be easier for parents to understand where do we, because all the parents, especially when the child is on the spectrum, on the autism spectrum, they want the child to speak. But to get there, we need to understand the process of speaking, because it's not just a motor process which happens into the basal ganglia. Yes, is not just that part. Both hemispheres of the brain needs to communicate for the actual speech to happen. The child might make some sounds, but this doesn't mean he's talking, or it doesn't mean that if he's literally talking, he understands what he says. So to expect speech in a child is a completely different step into their recovery or into their healing process. We need to start from the basics, which is the basal ganglia inflammation that comes together with a PANS. We can also call it encephalitis. It's got many, many names, and now you can jump in, Dr.
Oh,
Dashore.
yes. So yes, that is correct. Yes, yeah. Wait. I want to differentiate that. You're right. So PANDAS can also be called as autoimmune encephalopathy when it is a chronic condition, like with many of our children, or it can be called as autoimmune encephalitis when you are in an acute flare, right? That is when you would use the term encephalitis. Yes, that is an important aspect to keep in mind, that all of the underlying issues, I think that's what Alexandra is trying to stress as well, have to be addressed. When you start the BioNexus protocol, for example, right, it's all herbal. When you start the protocol, understand that we are focusing on health, not on speech. Speech is obviously, a broader focus, but when health gets better, what does that mean? Brain inflammation calms down. What does that mean? Right and left hemispheres of the brain, there is less inflammation. The basal ganglia are less inflamed. The immune system is a little bit more regulated. And now the body can focus its energy on healing and repairing and learning speech and language. Make sense?
I will go back to when Philip was little, and I would say around 2 years, and we could have hear him all the time. He could have sing, but he couldn't speak, because these two processes happens in different areas of the brain also. So you can hear the child singing perfectly, but can't speak with you, can't answer to the questions, can't say the words, but he can sing them. In the same time, when he was singing, I would have hear his voice, and his voice was always sounding a bit rough, a bit chesty. And you remember, I have always asked you about that, like, what could it be? And then you said, definitely he's got a lot of acid reflux, which again, you can't hear those sounds because his esophagus might be so inflamed, or he can literally have, how do you call it, Dr. Dashore? Help me out, because I've got so many things running.
Inflammation. It's actually known as eosinophilic esophagitis, which can be mild. I mean, that cannot really be diagnosed officially unless you are doing an endoscopy, which we know is very difficult for our children. But yes, so the voice can be Mickey Mousey, the voice can be husky and chesty and unclear, garbled. And yes, so inflammation, mucus production, that's so interesting. Go ahead, please.
And I remember that straight away we started to add the bitters.
Yes.
And straight away, I could have heard the change into his voice. Again, in my case, Philip could have sing. One side of the face was dropped. He could say some of the words. Some of the words, I knew he knew them, but he couldn't say them. Why? Because we were dealing with paralysis. You might say, my child doesn't speak, my child is retarded, cannot understand. No, he might have a clear motor function, like he can't move literally his jaw, or he can't move it into that way. He can yell the whole day, which is again a different way of processing the sounds. Me, I have finished music university, and I know exactly how the sounds are produced, and
yes,
the things are somehow making sense in my head differently. But I'm always trying to explain to parents, when you scream and shout is a completely mechanism of taking out the sounds. Then when you speak,
correct.
the muscles are involved, the jaw is a lot of effort, while for screaming you just need the lungs and it's coming out.
Yeah, let me stop you there so I can explain a little bit further two aspects that you mentioned, right? One was you mentioned about facial paralysis. that often comes from underlying infections, especially like Borrelia burgdorferi or Lyme disease. With Brian, as you know, Alexandra, we had that problem with his legs. For Philip and many other children that I see in my practice with PANS, Lyme disease is a major trigger for PANS. And you will see that, it might not be an obvious a facial paralysis or like a drop on one side, but there's definitely weakness. And the weakness in the facial muscles, the weakness in moving the tongue is a muscle, in being able to move the tongue, the weakness in being able to move the lips, right, phonetically, it is difficult for children that have underlying neurological conditions that is affecting the cranial nerves, right? Your facial nerve, your trigeminal nerve, or the vagus nerve can also be affected. So there are some cranial nerves that can be attacked by Lyme disease, and children, even adults with Lyme, can develop Bell's palsy that is obvious or just muscle weakness. Alexandra, I have one child in my practice that, not one, actually many, come to think of it, but they have an open mouth posture, not just mouth breathing when they are sleeping, right? With the mouth open and they're breathing, but literally all day the mouth is open. Like it's an open mouth posture, walking around with the mouth slightly, not gaping open, obviously, but slightly open. So that there is a muscular imbalance. Many of them, when they look at the screen or they're looking at a book, the eyes are squinting. That also gives you a clue that facial muscles are weak. Many of them have difficulty eating. The food is stuck in the mouth for a long time. It's like they are chewing
They often
forever.
choke with the food. They often literally throw up the food without any
Yes.
particular reason.
Yes, that's right. So those
Most
are
of
some
them
of
have
the
got
things that
crooked
can happen.
teeth, which again, the crooked teeth in their mouth is again another sign that their jaw is a very small and they can't get enough air inside for breathing. So that's another sign for them to look.
That's an important aspect. And then you mentioned breathing just now. Actually, before I get to breathing, I want to highlight one aspect you mentioned earlier with the reflux, the acid reflux. Now, remember, acid reflux can often happen silently, right? That is what Alexandra meant. That keep an ear out for.
Yeah, for example, I'll give
Yes.
more visual examples so parents can relate to it. And this one is also related with the open mouth breathing. Tooth decay. When the teeth are decaying, that might be acid reflux or might be again sleeping with your mouth open. The teeth are not covered in saliva, which they should be, so they get dry, and then it's the tooth decay starts.
The tooth decay, yes.
Yes, and also can be the mineral deficiencies as well. So there's loads of physical signs that you can see in a child and literally just say, oh, but this is normal for him. No, nothing is normal. Everything makes sense and everything has a part into their general well-being.
Yes, including what everybody wants, speech and language. That's absolutely right, So breathing, I'm coming to, but earlier you mentioned with the acid reflux. What I was saying was, right, sometimes the acid reflux can be silent. It can happen at night. You don't know. And some of the signs Alexandra just mentioned, yes, tooth decay. Now, one factor for tooth decay is also Lyme disease and mark-ons from the sinuses. So that aspect has to be considered. Anything that is affecting the breathing and the lungs. I'll often hear from many moms that, there seems to be some issue with the immune system. He's always getting a cold, and the cold always seems to be going into the lungs. It becomes bronchitis, and then it's lasting a couple weeks. The cough comes in. Correct. So understand that breathing and all the organs that are involved with the breathing mechanism, including your lungs, of course, are involved in speech development, right? Being able to control the breath will be involved in phonetics, in making sounds, even before phonetics, in just making sounds. Now, one step back before I forget is about acid reflux, and Alexandra mentioned bitters, correct? Bitters is helpful with acid reflux depending on, how acid reflux presents, mild, moderate, severe, etc. Keep in mind, most of the bitters available out there are alcohol-based. That is not for our children. The BioNexus bitters are non-alcohol based, very powerful, no alcohol. That is the important aspect you have to remember, right? Other than that, you can try other home remedies on your own, like a little bit of apple cider vinegar mixed with manuka honey, etc. The bitters need to be non-alcohol based. Right. And if you have any questions, send your questions. That's fine. I'm happy to elaborate further. And hopefully we'll be able to make BioNexus products available to the public as well, especially these key aspects. Alexandra, I'm just waiting to be able to finish my book, on autism and herbal treatment. That's when I'll be able to make the protocols available, but it's in progress. So hopefully, fingers crossed.
Oh, we know how busy you are, and we know how important it is for things to be presented in the right way. We know because all those protocols out there, there are so many lately that the parents are literally running to pick up anything that's on the market just to make them speak, which again, I think it's very misunderstood. For a protocol to work, you need to customize it for your own child. It doesn't matter, I don't know how much a product costs, how many good reviews has got from parents. I haven't heard from my experience, and now I'm just 5 years into it already, for a product that you just give it and it's just the wonder pill that's gonna cure everything and is gonna make the kids. No, everything needs to be customized, and dealing with a multi-systemic damage within their bodies, you need to address them specifically into the right order with the right products at the right time, again, so you can see everything happening in order, and finally to get to that speech that everybody is dreaming of.
That is going to be the purpose of the book, no fluff, no extra difficult science, etc. For that, you have my first book. So you can look at that. My first book on biotoxin illness was actually written for the many practitioners around the world. In other words, my students, and it has been written at a professional level. And then many requested, why don't you publish it? Okay, that's why I did that. So it is at a very scientific level. But the autism book will be just about the protocol, and yes, exactly what needs to be done first, and in which order things need to progress, and how a parent can themselves customize the protocol for their child. Yes, that is the key aspect. There are no magic bullets, no. So let's go back to what you were saying. Do you have anything else to add with respect?
I want to add a little bit, as we were just going to the mouth aspects and all that, and go a bit back to PANDAS, because whenever you're looking at teeth and you see imbalances and all that, you can also see infections. And from those infections, you can literally see a whole flare up just because they are growing a tooth. One of them is moving, they need an extraction, they've got decay, and there's infection happening. So we really need to look at all these aspects that can trigger a reaction in them. It might be aggression, it might be a change of behavior, it might be anything, but we really need to look at the physical signs that are there, but we just need to look at them differently. And for example, I remember now, it just came into my mind, Philip has got, his nails are ingrown, and when he was a little, every single time he would have had that, his behavior was changing because of the pain, and he wasn't able to say. he was literally getting infection around the nail because the nail was literally digging into his skin and creating pus and all that.
Yes.
And it was a change in behavior, a change in the way he was walking because he was always tiptoed. Now, again, see, in my head, they're going back and forth. If you see tiptoe, it might be literally just constipation. So you need to check for that. And not just for a child to go daily at the toilet, because they can go daily at the toilet and still have backup. They can still be constipated for a month ago somehow and have that pressure that make them walk on their
tiptoes, which causes stress, which is another trigger for PANDS. It may not be enough of a trigger for a full flare, but it can slow down progress. I like the fact that you mentioned something that could be seemingly disconnected, like an ingrown toenail, right? Because nobody really thinks about what is going on in an ingrown toenail. Those can often get infected. So then it becomes connected. Yes, a couple other things. Remember, ENT, ear, nose, and throat, is a connected specialty. Why? Because they are connected. So ear, nose, and throat. So if there is anything wrong anywhere, ENT, it can affect the lungs. It can affect speech development. It can affect, production of sounds. It can affect phonetics. It can affect right and left integration in the brain. Now, what is not, Alexandra mentioned right and left hemispheres of the brain. I've mentioned it a few times. That doesn't mean that you run out there, to the first treatment that is available that puts electrodes on the child's brain. Hey, we are integrating left and right sides of the brain. Please don't. That is not what I'm asking you to do. It is important, again, to listen to what is being said versus, thinking
going
about
for the solution. Yeah.
Yes, a fast solution. There isn't
the solution is not gonna last. And when I'm talking about that, is like if you've got ear infection and you go and you balance the brain, on the next ear infection, your brain is not gonna be balanced. So you've just wasted a couple of thousand to balance something that is going out of balance from a different root cause.
Yes, exactly. Yes, good point. I've had many parents mention this, that during an ear infection, speech therapy reports are not so great. After the ear infections, the child is, so other than the infection and discomfort aspect of it, it is also important to understand the connection between the ear, nose, and throat and speech and language. I want to talk a little bit more about ear infections. So there
I
are
can jump in
many
with some
children.
examples if you want me to, because I think they are representative for how they can look in a child. Patrick didn't talk up until he was 2.5 years. He wasn't on the spectrum or anything else. They were just saying his speech delay. Speaking with him daily, he knew all the colors, he knew all the cars. There was a problem when he was saying ambulance. He couldn't say ambulance. He was just referring to the color because it was white. For me, it was mind-blowing. You can say police car, you can say fire engine, you can say them all, but you can't say ambulance. You are just relying on the color. We took him in Romania. He had a tonsillectomy. They have pierced his eardrum to drain the fluid because he was having severe eardrum infection, 3 days after the surgery, my child didn't speak at all. He was just having his eyes wide open. He was looking everywhere. And I was like, what did I do? He is mute now. What's happening? No. He was in shock because everything that he was hearing previously was sounding completely different. Then we were going back to our activities and I was showing him different cars. And I was like, what color is this? And usually he would have said blue. But now the way blue sounded in his mouth was completely different from what he was hearing. So think of a child that has severe issues.
Yes, I understand that. So I have to give you one example, and I have to, clarify this a little bit. So what Alexandra is trying to say, and I'm sure you may have heard from your speech therapist as well, is that after a ear infection, or if a child has had multiple chronic ear infections, right, you may have to repeat some of the exercises or some of the learning points that were being done prior to the ear infection was fully cleared. Now, oftentimes ear infections, I see children that come to me, right, have mark-ons in the sinuses. Now, mark-ons is what? Antibiotic resistant staphylococcus. Okay, that is what's causing the infection. Now, staphylococcus is one of the smart bacteria like strep and Lyme. So if there is any other bacteria or even any other species of staphylococcus causing that ear infection, that antibiotic resistance is given to these other bacteria. So say, for example, the mark-ons is resistant to penicillin, amoxicillin. The most common antibiotic prescribed is amoxicillin. So if amoxicillin was given to a child with mark-ons resistant to penicillin, the ear infection may not have fully cleared. And maybe, if even a couple other antibiotics were tried. And what I find is that the ear infections often lead to chronic inflammation in the auditory canal, right? So using the herbal ear infection support blend for a couple weeks at higher doses and then using it for maintenance, that clears out that low-lying chronic inflammation in the ears. And when your child goes for speech lessons, you will see the difference. Mark-ons are cleared, ear infections are now cleared. Keep in mind antibiotic resistance. Just because your primary care gives you antibiotics doesn't mean that it is going to be fully effective. Okay, so fluid in the ears, yes, that was a great example. I mean, the poor kid, it's so important to look at it from the child's perspective, right? He's hearing differently. The one example I wanted to give you was, I discovered this really late, meaning that what you mentioned about Patrick, right? He was hearing himself and it sounded different. That is correct. With Brian, when he learned to speak, one of the secrets that he let me into was that, the reason why he did not speak earlier was because he was trying to speak and he was hearing himself sound weird. So
It didn't sound perfect as he was trying to, like he
Right.
hears you saying something, his emission is not. And again, we're going back now to Philip and to Brian because of the paralysis, all those
Yes.
dysfunctions for years. Because now here, I'm not talking just Philip. There are kids that are not talking for 8 years. And when they start to say sound, you expect them to start speech and literally tell you a poem from start to end. There's
Right.
phases that you need to
Right.
face because the motor function of the jaw hasn't been in place for so long. Definitely they've got impairment in doing it properly, and that might be one time when you just need to encourage them to speak instead of correcting them to say the correct sound. Just let them speak as they can. Don't discourage them. And then when they will fully understand what's going on and they will understand the meaning, then you can correct the expression, the position of the mouth, the correct way of speaking.
Yes, and it is not advisable to depend only on speech therapy, right? Oftentimes speech therapists, I found very few speech therapists that are actually aware of all of the scientific mechanisms that we discussed in today's podcast, right? Hopefully, that awareness will increase. But it is important to do this at home. It is, understand that your child is soaking up whatever you're teaching them. Just because they cannot tell you that, yes, mom, I understand, doesn't mean that they don't understand. And you will be surprised when language comes in, right? I'm sure you have many examples. I have
That's
many
a very
examples as
important
well.
point, Dr. Dashore. We just need to give them a communication method. It doesn't necessarily need to be speech. I'm following someone that she has taught her child the sign language. That
Yes.
child can manage to literally take out of the anger and everything, explaining himself into the sign language, and he's able to achieve so many things. And he has managed to explain to his mother, I don't know what I can't speak. And he was explaining into the sign language that he understands he needs to say the sound, he can say some of them, but he is explaining to her that he can't take them out. He's
Right.
trying, but
Exactly.
he can't.
Yes.
And I think that's a very important message.
Yes.
He's an 8-year-old child. He's literally understanding everything around. He's diagnosed with autism. He can do amazing things, you know. He's a bit delayed in some of the areas, but he managed to give the message, I can't speak. I want to, but I can't do it physically.
Yes, exactly. Yes. Now, sign language, many parents hesitate or they are told to stay away from simply because they think it will interfere with gaining actual motor verbal speech, right? Now, many children that are recovered from PANDAS, Lyme disease, mold biotoxin illness, many children on the spectrum who are recovered, they become multilingual, bilingual. So sign language is just another language.
Another tool, exactly.
Another tool, it's just a language which they will, eventually drop it. But in the long run, sign language is another language that can be useful to it's a skill is what I'm trying to say. So yes, two things come to mind. Speaking of sign language, the other things that I've heard, now I tried one of them and the other one was recommended to me, and then I've had other children that has been useless. So anyways, let me explain one. One is the frenulum, the removing the tongue tie. So oftentimes parents will be told that is one aspect of speech. Remove the tongue tie. It's usually a laser cutting. Qualified dentist will use a laser to do that. And then after that, you need specific exercises by a specially trained speech therapist, usually associated with that dental practice, who will guide you. I have never had any child in my practice, just my experience, benefit from that. I tried it. It was a complete waste of time for Brian. Complete. I mean, including the trauma of the surgery and then recovery, the scar tissue, the exercises. It was just, we had so much going on, another thing to add on. So again, with all due respect, only in my experience.
I can share my experience if you want me to, because I
Yes.
think it's very important. So from all my research, I have seen that my kids, both of them, have got tongue tie, and I was thinking that would be one of the reasons. Luckily, I have found, like in time before doing anything, that this is related to MTHFR gene. All the kids that
Yes.
have got MTHFR gene, they've got this, some of them got it.
Yes.
So now 80% of the planet have this gene, impacting them or not, which is not a reason to do it. And again, we're going to go back to the root cause, like what actually is impacting the child not to speak, because it's definitely not the tongue tie related to the MTHFR, but it might be the actual gene that is not working properly.
Oh yes. Oh my God. Don't even get me started on this over methylation. So many children have come to me with autism, without autism, with just PANS, Lyme disease, right? They've come to me with over methylation crisis. And it is ridiculous for a child with autoimmune encephalopathy or encephalitis, sometimes even encephalomyelitis, right? These children get NMDA receptor activation. It's a very sad situation for kids with PANDAS. And one of the things that is absolutely a no is methylation. Do not methylate this poor child. Okay, it can increase brain inflammation until you're sure that there are no mycotoxins or mold exposure. Absolutely do not methylate this child if you haven't already reduced the PANDAS brain inflammation first. And I often find that heterozygous MTHFR, no intervention is needed. Homozygous, meaning coming from both the parents, if the child has MTHFR and other mutations, right? COMT, whatever, CBS, only if the progress plateaus or detoxification challenges are seen, that is when we address the underlying methylation. But that too, this happens in very select cases. So overmethylation can cause, a brain inflammation. The child can appear to be schizophrenic, nonverbal. I mean, I've mentioned this with my son. Thankfully, he had a little bit of language then. It was disconnected, but we were highly recommended methyl B supplements, right? The methyl tetrahydrofolate, L5, and then methyl B12 shots, and complete nonsense. B12 needs to be other than methyl in the beginning, like I said, until mold, mycotoxins, PANDAS inflammation is resolved. And, folate doesn't have to be methylated. Folinic acid is what is required for the best processing in the body, not even folate, folinic acid, right? So Brian was having suicidal thoughts, trying to open the window to jump. And luckily, I always had my eyes and ears open when I'm in the house. And where did he go? It's been more than a few minutes. He's upstairs in his room near the window, trying to open so he can jump. Why are you doing this? He goes like, Mama, brain is swimming. Brain is swimming. It is just so heartbreaking when I heard him say this. And he burst into tears, started crying. And then, I got a hug, and it's like, thank you, Mama. Thank you, Mama. And then we brought him downstairs, and then, I called this practitioner, and that was it. I'm like, do you realize what this is? It's an overmethylation crisis. You don't need, anyways, I don't want to go too deep into this, but it is, sometimes practitioners are not available. The parents don't know what to do, right? Like a small dose of niacin, B vitamin niacin, can soak up some of that methyl groups. But that's just,
mention the gene because it's related to the tongue tie, and sometimes that's not the reason why it's happening. So don't go for the tongue tie removal, and just look for the actual root cause and have patience. I think patience is the most important thing in all the recovery process.
Yes.
From doing the right steps, which is clean environment, clean food, clean clothes. And when I'm saying clean water, I'm not just saying no stained clothes. I'm saying clean clothes because some of the toxicity can come literally from their clothes, from the materials, from the substances they are spraying and whatsoever. Exposure, again.
Correct.
Viruses and all that, and we can just go back and forth for everything.
Oh yes, many forms of exposure. Yes, washing the clothes. This is like, we'll have to do another one about various aspects of exposure, because some people might not even be aware. I want to clarify something that Alexandra said, right? She said, she's not a big fan of the tongue tie, but look for the root causes. Now, MTHFR is not a root cause. Just understand that.
No, I wasn't saying about MTHFR. Right. The root cause, I was just saying like detox can has an impact in the child, and if he's not detoxed properly, then toxins are building up, then a trigger can happen, and we're going to have a reaction, and the child can't speak because the brain is just gonna.
Yes, toxins build up also connects with constipation, Alexandra, that you mentioned.
That's what I had exactly into my mind, and I'm always relating to my kids because Patrick is suffering from severe constipation, and for him, having all those toxins inside of him and not being able to take them out, it can easily trigger him into a PANDAS reaction.
Correct.
This is where I was going. So I could have done for him as many surgeries and remove everything, because he's got a small jaw. All his teeth are growing crooked because there's not enough space. And as I said, he is a textbook PANDAS
Yes,
child. He's actually a textbook. And I could have done all these things the minute I have removed the excess load, which was for us, in his case, it helped. He didn't receive an autism diagnostic because he has been constantly as a baby on antibiotics due to ENT infections.
Yes.
And somehow the antibiotics were working, not setting him into to be textbook autistic child, you know what I mean? So that was one of the things that they were happening and we didn't know. But all these antibiotics have an impact on his gut and everything that we have seen later on in life. And then after we had the surgery and taking out his tonsils and all that, again, we have seen a lowering into the markons, into the strep that probably was in his throat somehow. I'm not recommending the surgery, but this is our solution for how many years infection he had. He was literally reading lips when he was talking, you know, this is how he learned how to say a couple of words. He couldn't hear at all. And everything was because of the ear infection that later on have affected him differently, because now whenever he's having a flare, his brain is being inflamed and we are seeing go into the behavior, into the aggression and everything that comes as a package. So again, there are steps that are taking us to show us that the child is going towards PANDAS, and the infection is going into the brain, the inflammation is happening into the brain, and there's a lot of activity. And again, I had those moments when Patrick was saying to me, I can't control my brain. I know that what I'm doing is so wrong, but I can't do it.
It's heartbreaking. I know. I fully relate. You know, it makes a massive difference, Alexandra, if your practitioner has lived it, being able to relate to you as one mom to another. Yes, yeah, been there. One thing you mentioned was, you know, I want to talk about tonsillectomy. That was recommended for Brian as well. It is widely recommended for PANDAS kids. And this was something that I wanted to learn, but I just didn't have time. You know, there is a wonderful Russian ENT surgeon in Germany who practices now as a Heilpraktiker, and he does cryotherapy. And this is what we had opted for Brian for. We had to go back 4 times. So cryosurgery, meaning, you know, freezing surgery of the tonsils using liquid nitrogen. That was something that we opted for instead of tonsillectomy. And that worked really well. You know, each time we would go, we had like 3 months symptom free, and then we would have to go back, obviously, because of re-exposure. But eventually the tonsils were clear. The one important thing that Dr. Sergei Durkov mentioned was, and he did that both mom and dad have to take the treatment as well. So he addressed both mom and dad, the tonsils and the sinuses. So that was phenomenal, because at that time, I did not have any information or any knowledge about MARCoNS. So that was really interesting. And, you know, it helped resolve, I don't know, like 30 years of nasal allergies for me. And it's not fun. Okay, this is liquid nitrogen, ice cold rod being stuck all the way up, you know. But Brian was a champ. My God. Our children are so much more intelligent than sometimes we give them credit. I mean, such an old soul. He sat there, mouth was held open, and, you know, he allowed this ENT surgeon to go in there, liquid nitrogen his tonsils. And I mean, he did better than the big baby of my husband, you know. So Right? I mean, it's just so that is one option which was available to us, but tonsillectomy sometimes is recommended, sometimes it is quite necessary
Okay,
as
Dashore,
well. I
I'm a
don't know.
converted parent, 7 years ago when we went through this.
Yeah.
Allopathic treatments were my only belief. If someone would have come and told me, look, in a couple of years, you will be this mother doing this and doing that, I would have said, go away, never, ever, ever in my life. I remember I've got friends that I was telling them, if you're not going to do this when the child is going to be born, take him to the hospitals and, the tip thing. I said, you're not going to be my friend anymore. You are uneducated if you don't do this. And somehow I think this was part of my journey, the conversion and all that, because I was fully believing. I'm not saying it's wrong to fully believe in the doctors and the treatments, but I was so uninformed and I was making recommendations when I should have just be quiet because I didn't have any research behind. Now it doesn't matter what it is about. I'm first doing the research, see how useful is that treatment, that process and whatsoever, what are the side effects, and then I'm going ahead to make a recommendation or not. But as I said,
Yes.
10 years ago, I wouldn't have even if someone would have promised me this is the safe way, I would have said no, definitely it's going to be surgery. So
we have both. I mean, I've had to go through conventional treatment for Brian for a long time just to save his life, to recover from the paralysis. I mean, given 2 months to live, losing weight. So we've been through a lot of trauma, and we've done the best we could with the options that were available to us, or the options that at that time, under that situation, we had the time to research. So it is, I remember spending day and night for like a week. My husband and I were like taking turns researching only probiotics. We did this, sorry, we took turns doing the same with this methylation nonsense. I mean, in such great depths, we had to go to make sure that things were in the right combination. Speaking of recommendations, one other recommendation that we were given after the tongue tie was using the ALF device, the ALF device for the mouth. It is given for TMJ, and sometimes, TMJ problems happen with Marcon's and Lyme disease simply because of muscular. You may find palate issues. At one point, I have photos.
We can pause for a second. I can literally bring them and show them to people so they can understand what we are talking about, because I've got them. My kids are wearing them. So
the ALF devices.
Yes.
Oh, okay. So at one point we had, Brian had like protrusion of his upper teeth, and this was in 4th grade. So it went all the way up to 7th grade. So I haven't seen any benefit from the ALF device. For you, it's different because all the Marcons, etc. treatment has been done. One moment.
Yes.
So ALF device, also again doing the right thing at the right time. So I ended up opting out of it. I did not go for it. I did not want to give him additional, responsibility, trauma. I did not want him to feel that because I wanted him to do it, he had to do it. It's very uncomfortable. It was uncomfortable. I'm like, no, thanks. And I haven't seen any kind of speech
I think we are
benefit.
talking about something different. We've got like mouth braces that are made out of a material that is a biomaterial, because we are attending
Okay.
biospecialist dentist, and is literally modifying, it's increasing the size of the jaw and is making space for more air exactly to fix these things, because you can't fix this with the protocol. This is a physiological, a bone structure that needs to be adjusted.
With the breathing. No, the ALF device is, ALF device is sometimes used for helping mouth breathers, I think. I'm not too sure, but it's mostly used for TMJ. And oftentimes, like I said, TMJ comes from infections and muscle imbalances. And it is, that is one of the reasons why I became certified in Beckman's oral motor, which is also known as myofunctional therapy, right? Oral motor exercises. And that's pretty much what we did to slowly modulate Brian's voice, from being like this, hi mama, how are you? Like this Mickey Mouse kind of a voice to slowly then, it was interesting because when he learned speech, his voice came out very immature sounding. And then mold, mycotoxins, Marcon's problems came into play with the hormones. So he went from this immature sounding voice straight to this voice changing. Hey, mom. What happened? So unfortunately, we had early onset puberty, which is seen like early onset puberty in males and females, early onset menopause in females. It comes with mold exposure. So that's what we saw. So yeah, I never really got to hear the normal childhood voice of my child. But yeah, I mean, it's all good. We've all had our own pluses and minuses. Okay, cool. So I think I'm just looking at my notes. I think we have discussed everything. So, things like ear infections, lung infections, bronchitis, eardrum bursting, and then sinus infections, Marcon's, acid reflux. Your child cannot blow the nose. Facial muscles are imbalanced, open mouth posture, open mouth breathing, even if only at night. All of these have to be considered as stressful events. And we discussed about PANDAS as well, how that contributes, the basal ganglia connection to speech and language. So I think I'm going to end up dividing this into two parts. It's a very long podcast. So the first half will be the scientific basis that I've discussed, and then it's going to be the mom-to-mom scientific discussion that we had with Alexandra today. Maybe we should invite other parents to just actually discuss what exposure really means. What should be considered as exposure? If you have anyone who wants to participate, good, and then I'll send invites out as well to all of my other parents who wish to understand
Definitely
the mysteries of exposure. So thank you everyone for joining me for today's podcast. Thank you so much, Alexandra, for being here. Much appreciated as always. I will see you on the next episode of the BioNexus podcast. Until then, namaste and take good care.
Thank you for joining Master Herbalist Dr. Jodie Dashore, Director of the BioNexus Health Clinic and BioNexus Herbals, on the BioNexus Health podcast, where we explore and share information and stories about recovering and healing from chronic and environmental illnesses such as mold biotoxin illness, Lyme disease, autism spectrum disorder, fatigue, Crohn's and colitis, mast cell activation syndrome, PANDAS, and more. Please help us grow our message by subscribing to our podcast channel and sharing the podcast on your social networks. For more information, visit bionexushealth.com.
Information within this video, audio, or text, collectively known as the podcast, has not been reviewed by the FDA. Nothing within the podcast is intended as or should be construed as medical advice. Information is for general informational and educational purposes only. Consumers of the podcast should consult with their healthcare practitioners for medical recommendations. Seek the advice of a qualified healthcare provider. Do not disregard the advice of a healthcare provider based on any information from the podcast. The information within the podcast may contain information concerning dietary supplements or over-the-counter products that are not drugs. Our dietary supplement products are not intended for use as a means to cure, treat, prevent, diagnose, or mitigate any disease or other medical or abnormal condition.